A number of officials tell me today they are in the very early stages of trying to build some prediction models. You've heard the term flatten the curve. Well, what exactly could the curve look like for us here in this region? Best and worst case scenarios for the number of people getting sick, needing hospitalization, and also ultimately dying. A number of people I talked to today said that really depends on you.
New York is scaring us. The trend there is exponential in both cases that they're finding and deaths.
Pam Walker used to head health and emergency response departments in our area.
I've never seen anything like what is happening in New York.
But how will the virus impact us?
We don't have good data yet on who's going to get the sickest and who's going to die.
I called around to local and state health officials. The state of Missouri says modeling isn't yet available. Not a surprise to Walker because of a lack of testing.
We can't just assume that St. Louis is going to be like Italy or China. We can't just assume that. America's different. So we're not going to have solid projections and be able to make decisions about opening things back up until we get more people tested and we have that surveillance data.
Sources tell News 4 the St. Louis County Council, though, has been briefed to expect cases to double every 3 days, with a possible total of 200,000 people infected, about 20% of the total population in St. Louis County. If hospitalization trends from New York continue, that could mean close to 30,000 people hospitalized.
I don't know if that's right or not. Until we get better testing, I'm not going to guess.
Walker says it's really still all so new.
This is a disease we don't have 100 years of experience with.
Since we don't have projections, we don't have models, is it best to just assume the worst?
It's best to assume that the worst will happen if we don't put restrictions in place.
Dave Dillon with the Missouri Hospital Association says his organization will soon be working with the state of Missouri to gather data for prediction models.
We're absolutely planning for it because we would be practicing, malpractice. It'd be malpractice not to plan for it.
But he shares Walker's opinion. The biggest variable is you.
People, please take it seriously. Protect yourself, protect your family, and stay home and social distance.
St. Louis City Mayor Lyda Crewson today said they also expect their cases to double about every 3 days or so. When we talked to her today, she did confirm there are cases in every zip code in the city. Certainly, we will continue to request the reports and the data on this issue. We'll bring it to you as soon as we have it. Reporting in West St. Louis County, Lauren Traeger, News 4.